Last week was very similar to the previous week in the coronavirus epidemic in the city, which is generally good news because the last week was a sign of decline over the weeks before. Now, I do have several revisions on how we count cases to explain today, though. So here are the numbers. Since this time yesterday, we've identified 59 new cases of confirmed coronavirus infection in Philadelphia residents. I want to give you an explanation before I give you other numbers. First is a correction on the total number of confirmed cases to date. Here's the explanation behind that. We get tests reported directly to us from most laboratories in the region, but not all. And the State Department of Health gets tests reported directly to them by most laboratories in the region, but not all. And we send files back and forth daily between us at the Philadelphia Health Department and the State Health Department to get the cases that they have that we don't know about and to have them know the cases that we know that they don't have about. That matching is a complicated process. It involves computer steps and involves a human review. We recently discovered that there were 376 cases in Philadelphia residents who were tested between March and August of this year that were not identified in this process. Those are going to be added to our database today. So the total number of confirmed positives today is 36,887, not 36,511, which is what you would get if you were to add today's newly case reports to yesterday's total. Now that correction, adding those 376 previously missed cases, increases the total case count by just about 1%, and it doesn't change the overall shape of the epidemic wave or interpretation of where we are in the epidemic. And it doesn't change the case count here in September. The two other data issues I want to talk about. First, each day we report the number of new positive test results we received since the previous day. We'll continue to do that. But because the data comes to us from laboratories after a delay in batches, the graph on our website shows the data by the date in which the test was run in the laboratory. That's the way we did it from the beginning of the epidemic. But starting today, we're going to make two changes in the way that we show the data on this graph. First, we're going to change to graphing it by the date of sample collection. It's the date that someone was in a test site and had the test swab collected, rather than the date in which the test was run in the laboratory. The advantage of this is that by graphing by the date of the sample collection, when a person was at a test site, it makes the graph closer to reflecting what is actually happening with the epidemic. And it won't be distorted by the time it takes for the lab to run the tests, and that time is variable according to which laboratory the test went to. So last week, by date of sample collection, we averaged 74 confirmed cases per day, a total of 517 cases for the week, and 2.5% of people tested positive. Those numbers are similar to what we had the week before. Now, as always, there's delays that we get for some of the reporting, so those numbers are likely to grow a little bit with late reports. And the second change we want to talk about today as far as data reporting is that we will start reporting separately the number of people with positive rapid tests. Now, the rapid test machines are appearing in more places now. More people are getting these rapid test results. That's good, but the results may be false positive. And not everyone gets a standard test, a PCR test, to confirm a positive test to be sure that it is actually positive. So if we get a positive rapid test without a confirmatory standard PCR test, we're going to call that a probable case. It's the same things that other jurisdictions around the country are doing. Since the beginning of the epidemic, we have only 180 probable cases from rapid testing. But we do expect this number to grow as rapid testing becomes more popular. For last week, we have 50 probable cases from rapid testing for the entire week that we'll be adding, and that we'll be displaying on our website. Now, a couple of notes here in interpreting this. Not all rapid tests are reported to us, and we're working with sites to get them to give us this data. So our number of these probable rapid tests will be incomplete, but we will report what we get. Second thing to note is that if a person has a positive rapid test and later gets a confirmatory PCR test, we will convert that person from a probable case to a confirmed case, which means that our probable case count may actually go down over time. That's where we are with case counts. Now with the epidemic or otherwise, in schools, fortunately, we are not seeing any clusters of infections in any of the kindergarten through 12 schools that are open so far. We have seen isolated cases in staff and in students. We have no evidence yet of spread within schools of the infection. As far as cases now, as far as deaths, we have one additional death to report from the coronavirus infection, bringing us to a total of 1,801 since the beginning of the epidemic. Our data on deaths comes in batches. We're averaging about 1 to 2 per day right now. And our graph on the website is by the date in which the person dies, and that's not going to change with these other changes. That's what's happening in Philadelphia. Now, in Pennsylvania as a whole, you're seeing the daily case counts have been pretty much level over the past week. But in the United States as a whole, case rates are now rising. They're still rising compared. They were rising a couple of weeks ago, and they're still rising. They're particularly rising in the big center of the country: North Dakota, South Dakota, Wisconsin, Iowa. Those sites are seeing very sharp increases of their infections. Back here in Philadelphia, what's new on testing? We continue to put more information on our website, www.phila.gov/testing, where you can go to get tested. The rapid tests are increasingly available at the different test sites. There are machines in nursing homes, and these card tests was announced yesterday. The federal government will be distributing these tests that can be done on cards that don't require machines. They're going to be distributed to the state of Pennsylvania, and we hope in the city of Philadelphia sometime soon. I don't have more details on that, but look forward to knowing more about that. Last week, we issued guidance to doctors about how to use and interpret these rapid tests. The key messages for doctors, which other people might need to know as well, is that these tests can have both false negative and false positive results. The likelihood that a result is false negative or false positive really depends on the situation for the person who's tested. And that people may need a standard PCR test to confirm either a positive or a negative result. And any clinic that is setting up these rapid tests, particularly with the card tests, don't have the machines that maybe many clinics doing that, they need to report the results to the health department so that we have the data so that we can track the epidemic. Now let me move on to our social distancing restrictions. Our falling case counts in Philadelphia over the past few weeks show the success of our strategy. Our strategy involves containment, that's testing and contact tracing and isolation and quarantine, and then also the social distancing restrictions. Limits on people gathering together and trying to keep people separate, and the use of masks. I said that as case counts fall, we would scale back restrictions gradually and carefully. Now, the governor announced recently that he would allow restaurants to expand to 50% capacity indoors effective September 21st. Here in Philadelphia, because our case counts have been falling, we will allow restaurants in Philadelphia to do the same, to go to 50% capacity for indoor dining effective this Friday, October 2nd. It's important, though, to know that there are other restrictions here. First, under the governor's rules, if restaurants want to do this, they must self-certify on a website that they're following state and CDC safety guidelines. The safety guidelines are very important. Restaurants also must follow the city rules, including these rules, that the tables have to be spaced so that all diners at different tables are at least 6 feet apart. People can be closer to that within a table, but a diner at one table has to be more than 6 feet apart from a diner at another table. The tables themselves can have 4 or fewer seats, no more than 4. The idea is we want only household members to be dining together. We don't want people from different households to be dining together because that'll increase the opportunity of spread between households, which is a big part of our problem right now. There's no seating at bars. No alcohol will be served except during a meal. These are state rules that we strongly endorse because bars are clearly even higher risk settings than restaurants. And the city rule is that servers have to wear masks and face shields. That's because the servers themselves, who are going to be in contact with many people dining there not wearing masks, are going to be at the greatest risk. And we encourage all restaurants to improve their ventilation, such as opening their windows and doors or optimizing their heating, ventilation, and air conditioning systems. But no matter how much restaurants improve the ventilation indoors, the ventilation outdoors is going to be much better. So even as we're expanding the opportunity for restaurants to have more diners indoors, we want to encourage restaurants to have outdoor seating, and if anything, to increase their outdoor seating, because we do think that's a much safer environment for diners. So that's what we're doing with restaurants right now. I can tell you that we will be looking at our other social distancing restrictions, and we will scale back others as appropriate. But let me remind everyone that if case rates start to rise, which they very well could as weather gets cooler, depending on what's happening around the rest of the country, we may have to reimpose some of these restrictions. And finally, just a reminder that much of the progress we've made really is because people are wearing masks. I note today that the percent of people who are wearing masks in our observations, as we see in the graph posted on our website, has fallen in the last couple of weeks. And our observations has gone from in the 90% range to 80% and now 76%. Now that may just be random variation. There's going to be random variation from week to week in our observations, but definitely it's a reason for our concern. So we need to keep this up, especially as the weather gets colder and people move inside. People need to wear masks. When do you need to wear a mask? whenever you're indoors around people other than your household members, whenever you're outdoors within 6 feet of people other than your household members. All of our information is on our website, www.phila.gov/COVID. Thanks.
Yeah, hi folks. Questions for Dr. Farley on 50%. Dr. Farley, the Restaurant Association will argue they've lost 20 to 30% of restaurants statewide. And one of the things they're saying is to continue to restrict bar service and to restrict the idea of people being able to get a drink without food, they think will continue to drive their industry under. And they say that to continue to do it, they think people will go rogue, that people are having backyard parties, and it prompts that sort of thing where the spread of COVID might be more severe. What are your thoughts about that argument?
Well, first, I'm sympathetic to the restaurants and bars that are losing revenue through this. It's really been tough on them. On the other hand, we absolutely know that bars are high-risk situations. They're clearly higher-risk situations than restaurants. Lots of examples around the country of rapid spread within bar situations around the world as well. And so that adding bar service would absolutely increase the risk. And I don't think there's any evidence that says if you shut bars down, that just drives the behavior elsewhere and you have the same level of risk elsewhere. Just the opposite, in fact. There was a big outbreak in the Pittsburgh area a couple months back that shut down bars, and quickly the outbreak was quelled. So again, I'm sympathetic to them, but that bar situation is just too risky right now.
Doctor, do you have any thoughts about putting together a winterization task force, or thinking about and offering guidance about restaurants staying open through December and actually having outdoor dining in the winter? They're wondering about that as well. What are your thoughts there?
Yes, I know that people at the Department of Commerce are talking to people in the restaurant industry about ways that we can make it easier for restaurants to offer outdoor dining as the weather gets colder. I think that's an excellent idea, and we would be supportive of that. As long as they can maintain the high level of ventilation that occurs outside and have people be comfortable outside, that is absolutely safe for environment.
The last question I have for you. I think there's a House bill, 2513, in the legislature that's passed the House, passed the Senate. Senate has to sign it. The governor doesn't seem interested in it, but it does seem to pull away a number of the restrictions that you and the state wants to hold in place around dining. If they were to override the governor's veto, do you think that bill is simply not good for the health of the state, not good for Philadelphia?
I don't know what's in that specific bill. I do know that there's been a number of bills that the legislature have proposed to override the governor's safety restrictions. I think all of them are a bad idea. I think that the governor has done an excellent job at protecting the residents of Pennsylvania with his restrictions. I understand that those restrictions are tough on businesses, but we don't want any more people to die than is necessary. And I think the legislature should allow the governor to act as he has.
Thank you.
Thank you, Jeff. And now we will go to Laura McChrystal of the Inquirer.
Okay. And a question for Dr. Farley about the rapid tests. You mentioned that they're being categorized as probable cases because they can have false results. So if someone gets a rapid test, what would your advice be to them? Like, should they trust the results either way, or how should they treat that?
It really depends on the situation. If someone has classic symptoms and has a positive test, that's very likely to be positive. They probably don't need a confirmatory test. On the other hand, if they have no symptoms and they have a positive test, it could be a false positive. They probably need a confirmatory test. And if they have classic symptoms and they have a negative test, that could be a false negative. They probably need a confirmatory test. We've given very specific guidance to doctors about how to handle different situations like that.
Okay, and even with all the potentially confusing situations, that they are still something that you recommend as a tool for testing?
I think that they are valuable in certain situations, but because they're not perfect, they have to be used carefully. I think the best situation is for people who have classic symptoms, fever and respiratory symptoms, because if you get a rapid result, then you can more rapidly do contact tracing and all the work around prevention. For somebody without symptoms, they're probably not the best idea.
Okay, that's all from me.
Hello, this is for Dr. Farley about indoor dining. So with the number of chairs at each table limited to 4, does that mean a family of 5 cannot go to indoor dining? And if so, how did you come up with the 4 number?
That is correct. Certainly any number you put there might be some people with households larger than that. But certainly if you have a table with, say, 6 seats, that's too many opportunities for people to just decide to get together with a group of friends and be spreading between households. So it's not a perfect limit, but it is a limit to try to send the message that this is really just about people within households. And I'm sorry, if you have a household of 5 or more people, you're not going to be able to eat out inside.
And my second question is about the limit of 25 people at indoors. Does that apply to these restaurants? So can a restaurant with a capacity of 100 have 50 people, or do they still have to have 25 or less?
Now that 25 limit is for gatherings. That does not apply to restaurants.
Okay. And has there been any thoughts about lifting that or expanding that now that it seems like more restrictions are being lifted, expanding the 25?
The indoor gathering limit of 25 is a state restriction in addition to a local restriction. As I said, we are looking at our restrictions to see what might be appropriate to scale back on. But likewise, the governor would have to make similar changes in order for that to change.
These 2 questions are for Dr. Farley. Dr. Farley, yesterday the president mentioned, or at the president's press conference, there were 50 million tests being distributed. Are you aware of when Philadelphia will get its version of that test?
I'm not yet. This is the Abbott Binax Now card. These are tests that can be done without having a special machine. They still need to be done in a clinic. There's still restrictions to them. You have to have special training. You need to do them correctly to get the correct result. I'm told that there's some 100 million of these cards that are going to be distributed to state health departments. And the state health departments, in turn, are going to have to figure out where to distribute them to. I haven't heard when they will arrive or how we might receive them here in Philadelphia.
Would you, could you rather explain whether that really impacts the spread of the virus, whether or not having rapid tests actually impacts it? Because the White House was basically saying this is a reason for cities to open the schools, and as we know, that's problematic. But I would love for you to be able to explain to my audience what would be the reasoning for Philadelphia to reopen the schools versus just having access to rapid tests.
Rapid testing is one tool that can help us respond to the epidemic. It is not going to revolutionize everything. And in general, let's remember, a test by itself doesn't prevent the virus from spreading from one person to another. All a test does is give you information that you might be able to act on. So the potential advantage of the rapid tests is for somebody who has symptoms to identify quickly whether that person has COVID, so that you can have that person go into isolation and you can start your contact tracing and have their contacts go into quarantine very quickly. The disadvantage is you may have a false positive result. And also, remember, this test is not a home test. It needs to be done in a clinic. And so unless a school has a clinic, they're not going to be able to do it in the school itself. So I do think that there's a value of this in evaluating students or staff who have classic symptoms of COVID, so that they can quickly start the process for containment if they have a positive result. But it's going to be a while in figuring out how to make it available to those people. And it's still not going to prevent spread from people who don't follow isolation and quarantine or don't get tested in the first place.
Thank you.
All right, thank you, Martin. Let's go to Manny Smith of CBS 3.
Hey, good morning or good afternoon. A couple questions from our team today. Our question number 1 is for Dr. Farley. The American Academy of Pediatrics says there was an 18% increase in COVID-19 cases in children between September 3rd and the 17th. Any thoughts on what you think is causing this and any concerns about the new trend?
I hadn't seen that data. I can only speculate that during that time period is when we had college outbreaks across the country. And it may be that college age students are likely to be in contact with younger siblings, or maybe that some of them actually fell in as pediatric cases themselves, and that was connected to that wave.
Also for Dr. Farley, again, and forgive me if this is the second time answering, just wanted to get a square answer on it. The school district has been open about wanting to return to public schools, our return to class, in-class instruction in November.
Right.
What are your thoughts about that? And where are you in communication, discussions, planning for that with the district?
You know, we have issued safety guidance for schools, both elementary schools and middle and high schools. And it is our position that schools can open safely, both public schools and private schools. As you know, the parochial schools are offering in-class education, and independent schools as well in Philadelphia right now. And as I said a few minutes ago, we have no evidence yet of spread within those school buildings for the schools that have opened up in person. So we do think a lot of safety procedures need to be put in place, but we do think that the schools can open for in-person education in November, as they've discussed, in a safe way.
All right. And my last question is, listen, we're all encouraged by the positive trends and numbers that have been happening kind of like, globally in the city. Is there anything or any activities or any behaviors that you're still seeing in the city that you want people to stop doing or do less of?
It's very clear that the major way the virus is being spread right now is within households, and then between households and their close friends and relatives, often through small social gatherings. So I try to emphasize that in previous press conferences, that when you have your uncle visit, or you're visiting your grandparents, or you're visiting your cousin, or you're visiting your neighbor, these are people you tend to trust, and you tend not to wear a mask around them. But those are the people that you're most likely to get infected by, so you need to be wearing a mask and have them wear a mask when you get in contact with those folks. And then everybody should be staying away from social gatherings, parties. We all want to get together. We're humans, we're social animals, but getting together indoors without masks is a very high-risk situation.
Thank you, Dr. Farley.
Thank you, and thank you, Manny. Let's go now for the end of the first round to our Henny's Figueroa of Univision.
The question is to Dr. Farley, and it is whether that 50% allowed for indoor dining will be maintained until the cold weather is with us.
That 50% allowed will be maintained as long as we think it is safe. So if case counts continue to be low, we don't have evidence of spread within restaurants, we will continue to allow the restaurants to do that. If case counts begin to rise and we have evidence we have evidence of spread within restaurants, then we'll reconsider that. We do recognize it's a high-risk situation, and so we want to again reemphasize, including for Spanish-speaking audiences, that we want to encourage the restaurants to take advantage of outdoor dining as much as possible.